This next exercise is to help reverse the PEC pattern, which is a primary extension chain pattern. That's what it means. So basically there's a dominance of calves, hamstrings, glutes, erector spinae muscles into a pattern where the femurs start to orient outwards, pelvis rocks forward, big anterior tilt, be weird for the body to stay here, so the ribs then flare and the head comes forward. So sometimes people walk into the clinic like this when they've got a sore back. But it's, even if someone's standing straight, I can usually see it now in people, but it's a position that when I do testing, I see that's the position the body is in, and it affects neck problems, jaw problems, shoulder problems, hip problems, lower back, knee, even feet problems too, and usually problems that people find it difficult to get the help they need to unwind the problem, because it's to do with the pattern itself. So this is a way to unwind the pattern, or it's a beginning of unwinding the pattern. In this pattern here, the thoracic spine is usually quite flat. It needs to have some roundness to it and be able to expand. So when the body's in this PEC pattern, the breathing is quite easy to do sideways. So when we breathe, the ribs go up this way. It's a bucket handle movement, and a pump handle movement is front and back. So there should be expansion going front and back of the rib cage, and expansion going sideways too. Usually the back doesn't get as much expansion as needed, and it can actually change a lot of things just by getting that to happen. So what we're doing with this exercise, we can use a foam roller or 2 rolled up towels to do it, whichever feels not as tender for you. And the main thing is you can relax into the objects. We're putting it about where the nipple line is on the side ribs, and when we compress the ribs at the side, it allows the breathing to become more front and back. So it gets more expansion through the back and also through the front here too. So that's what we're doing here. So the way to set this up, I'm going to use a foam roller. So I'm going to pop this with about the nipple line, so I'm not too high up in my armpit there. And I'm bringing my knees up, really important. So knees and body are 90 degrees. This allows the pelvic diaphragm and the respiratory diaphragm to now face each other, whereas before they were not facing each other and creating compression in the back and difficulty creating pressure and correct tensioning in the diaphragm or diaphragms. So I've got this here, that's really important. I'll have this position. Then I'm letting my neck relax. So I'm letting my lat relax here, the arm supporting. My shoulders are stacked on each other, hips are stacked on each other. So I'm not sitting back or sitting forward or like this or like this. They're just stacked, shoulders on shoulders, hips on hips, and neck totally relaxed. If the neck's not relaxed, it's hard for the whole body to relax. And now I'm just breathing in and out through the nose, tongue on the roof of the mouth. As soon as the tongue is on the roof of the mouth, the intra-abdominal pressure can compress more adequately. And I'm just aiming to, as I breathe, I'm melting into the roller here or into the towels. So I could have a pillow here, so my neck can stay really relaxed. I'm staying here for 2 minutes. And this can be very, very relaxing. Some people almost fall asleep on the clinic table, especially if they're really stressed or in chronic pain, because it's activating the ventral part of the vagus nerve, which is the front part, which is to do with relaxation in a system that's relaxing, going back to balance. It's a healing state in the body. And change side. So as I change side here, I've got shoulders stacked on shoulders, hips stacked on hips, 90 degrees, head, neck relaxed. Then I'm just letting myself melt into the foam roller here. Breathing in and out through the nose, tongue on the roof of the mouth. Just letting my body relax. So I'm just going to use the 2 rolled up towels here. Top that level of the nipple. I'm going to use the foam roller as like a pillow. So I'm going to use 2 rolled up towels here. Place them at the level of the nipple. Just going to use the foam roller for a pillow. You can use a normal pillow too. Knees pulled up 90 degrees here. Shoulders stacked on shoulders. Hips stacked on hips. Breathe in and out of the nose. Tongue on the roof of the mouth. Just melting into the towels here. And swap out, placing the towels level of the nipple, letting the head rest. I can do this with my hand too, as long as the neck is relaxed. 90 degrees. And just relaxing and melting in 2 minutes.